Hey everybody, Dr. Bryton here for Two Tip Tuesday. First things first, I need to apologize at the delay in getting this video out. I will tell you that we had a special guest star planned for today and found out that she was unable to make it. Our filming crew was advised of this, and I will tell you, as that guest star's father, who lives about 10 feet away, and she lives down the hall, the 10-month-old, that is my daughter, was in no shape to be in today's video because she is teething. So, I do apologize, it's a little bit late. We were kind of ad-libbing this, and we'll go from there. But do look forward to seeing Lakeland here soon on these videos when she's feeling a little bit better. So we're going to ad-lib this, and the topic I chose for today was essentially the air quality in our office. One of the things that I have found a lot of patients have wondered in the last 5 weeks is, all right, how clean is the air at Mansfield Family Dentistry? And I will tell you, it has been a concern of mine, and it has been something I've had to research over the last few weeks to improve or look into the safety that we have been putting, or safety that we are putting in our patients in, our staff in. And so I will tell you right out the gate, I have been extremely proud to have found that our office has been very safe. Which is really, really cool. It makes you feel a lot better when you find out things were done well before we knew that there was even a problem. So I'm going to get into it. There are big factors in determining the safety of the air in the dental office. With the aerosol creation, which you've probably heard about, you need to be in tune to this, and we have discovered that Mansfield Family Dentistry is very clean. Two big factors. First and foremost, your high-speed vacuum, or the suction that we have, as well as any air filtration that you have. And I will tell you, Mansfield Family Dentistry has air filtration units and has for over a year, and that is not something that is generalized across all dental practices, and that's part of the reason we are proud to be able to go over this. And so I'm going to get into some research here really quick. This was research that was done by Rella Christensen, who has a PhD in physiology and microbiology in the Northwest United States. And she did some research with regards to the particulate that's in the air in a dental office versus that of ambient air or natural air. And there's a couple of things that I wanted to note here. And again, I don't want to spend too much time on this, but this is average ambient air. And again, particles per cubic feet of air, and you'll see there's 35,000. If you jump up here to the top one, this is with an air purifier and suction, and you'll see that it's 3,500, about a tenth of the particles in the air. That's a really cool thing to know that Mansfield Family Dentistry has been utilizing both of them, because you can see just with high speed or just our normal suction alone, you still have a good amount of particle, but not much more than natural air. It's if you didn't use any of that and you didn't use filtration, you can see the amount of particles that are put in the air. It's about 896,000 particles in the air. That's a significant amount. And so the safety measures that we have put into place with our suction and our air purification has been really cool to find out is working. And so we're going to do a little bit of a field trip. If you recall, about a year ago, we went over our air purification that we have in the office and got in the office, and it's been really cool to hear about what this is doing to protect our staff and our patients. So this is our Surgically Clean Air Cascade White Unit. And if you remember us talking about it, this unit flips over the air in the dental office about every 4 minutes, cleaning the air, and it goes to a particle size of roughly 0.01 microns. And here's what's making me smile. COVID is 0.125 microns. That means we've been cleaning the air of COVID. And that's a really cool thing to be able to look back at and tell our staff and even tell you as our patients. In addition to that, if you recall, not just that big white unit we have back there, we also have up front, right at the entry, what's called the Surgically Clean Air Carbon Granite Unit. And this is working in our reception area doing the same thing, which is awesome. The combination of those two units, again, flips the air in the dental office, in our dental office, about every 4 minutes. And then from there, you combine that with the high-speed suction that we use, and you get that statistic that I showed you at about a tenth of the natural particles that happens in ambient air. We get about a tenth of that, which is a really, really cool thing to find out after we stepped into this COVID environment. I will say that there's many more things that we're going to be doing to improve the environment, and we will let you know about those as we make decisions on them. But I just wanted to start by letting you guys know that all the air here in Mansfield Family Dentistry has been very clean. Even before we knew COVID was a problem, we have been protecting ourselves and you against it. The last thing I'll leave you with is that big white unit that I just showed you, which kind of cool. It actually was brought into production because of the SARS outbreak, which is obviously a relative to the COVID virus. And so it's been pretty cool to be able to look back and go, wow, we did something really good, and we maybe didn't even know we were doing it. So looking forward here to getting into some other things and protecting ourselves and our patients even more. So thanks so much for tuning in. Hope you have a wonderful rest of your Tuesday and a great rest of your week. If you have any questions, please reach out. Even if it's about this air purification, please do so. And look forward to seeing Lakeland in a upcoming Two Tip Tuesday video. Thanks so much.